We're pleased to be joined by Dr. Pamela Clarke, President and CEO, Newark Community Health Centers. Good to see you, Doctor.
Thank you for having me, Steve. It's a pleasure being here with you.
You know, we're doing a lot of programming around diabetes, diabetes awareness, but I don't want to assume everyone knows what it is. 3 types, what are they?
There are 3 types of diabetes. There's type 1, that means that the pancreas produces little or no insulin, which is what's used to regulate glucose in the blood. Then there's type 2, where the pancreas does produce insulin, but it's not enough, and the cells don't know what to do with it. And then there's type 3, which is gestational, when you're pregnant and you have high blood sugar in your body.
Explain to folks why diabetes is a problem.
Diabetes is really a serious problem in our community. One, because how it impacts your body. Now, think of you going to work every day feeling fantastic and you're feeling dizzy. You get up in the morning, you're feeling dizzy. You wonder what's going on. Body doesn't feel well. Let me sit down for a few minutes. That's diabetes coming on. You may feel thirsty, or you may feel hungry often, and you keep eating thinking that, oh, you have a good appetite, let's eat. Or you feel that you're thirsty all the time, let's drink some water. That is diabetes.
It could be diabetes.
Could be diabetes that is affecting your body, but you pay no attention to it because it's a normal part of living, except the dizziness.
Why is it so important that people be aware of the signs, the symptoms, and how to deal with diabetes, not prevent as well?
It's very important. So these may be simple signs, and some people ignore it, but how it impacts the body, the high glucose level, sugar level, let's call it sugar, because our people talk about sugar.
Right.
And so if your sugar level in your body is high, it has various serious implications on the cells in your body. So for example, you're gonna find that if you get a cut, say on your toe, or you get a cut on your hand, it won't heal properly. And then you keep looking at it thinking that, oh, it's a little sore, let me ignore it. But then because of the high sugar level, the immune system does not work properly, it becomes a big sore, then you have an infection, then you have to lose the toe, or you have to lose the hand.
Why is it, doctor, that there was a study done, by the way, on diabetes in Newark, correct?
Yes.
Who did the study?
Well, Robert Johnson did a study in Newark, and also
RWJ Barnabas
Barnabas Health, yes.
And Newark Beth in particular?
Yes. And
one of their hospitals?
Yes, and we partner with all of the hospitals in Newark because we are a close-knitted family, the Robert Johnson Barnabas Health System. And so what we found is that in Newark itself, there's a rising number of diabetics in the population. By 2016, it was 21% of the people in Newark that had diabetes.
21%?
21%.
Well, compare that in the state and the nation. Is there a higher percentage of diabetes among Newark residents?
Yes, there is. If you look at that number in 2016, you're going to see that it's 80% higher than the national average.
80%
and
higher.
2/3% higher than the state of New Jersey. Newark is special, where we're having a large number of the residents there having diabetes. Last year, we served under 2,000 people who had diabetes, which at Newark Community Health Centers.
By the way, let's clarify, we said this before every time you've been with us. You are a federally qualified healthcare center.
Yes.
You serve the people in their community with very specific clinical and healthcare needs.
Yes. And because we serve specific people in the community, in underserved community that have healthcare disparities that are very, very high, especially in Newark, you're going to find that last year, as I said, we had under 2,000 patients that were diabetic. Now we're up to over 3,560 people that are diabetic. And these are the ones with uncontrolled diabetes, which means their blood sugar level is 9 and higher. That is serious business.
How do you treat it?
Well, what we do first and foremost is we have to come in and give them health screening. Most people won't come for a simple health screening, but they have to come so we could check their glucose level. People think it's not important just for a simple health screening to check your blood sugar, but it's very, very important. So when you come in, we can do a blood test or finger stick, and we check your hemoglobin A1C. When we find that your diabetes is high, then you have to go on medication. You have the registered dietitian going to come and talk to you to tell you about...
Why is the dietitian relevant? Excuse me.
Because eating is important. We love our food, Steve. We love our sugars. We love our ice cream and cake. And so we need the registered dietitian to talk to the patient, to ask them, what's your eating habits? Maybe you could just not eat so much ice cream every day, cut back on the wine, and maybe not eat so much sugared foods.
What can you lower there? Is it your What do you lower? The level of
sugar that's taken into the body that's being consumed. So when you put too much sugar, glucose.
Right.
I like to use the word sugar because people who were listening may not want to hear glucose.
But you don't understand sugar.
But it's sugar. They understand
Same
sugar.
thing, though.
Yes, it is.
Okay.
Sugar, glucose is sugar. So when you eat all those donuts and you eat all that ice cream, it gets in your body, digested, you're producing glucose, which is sugar. When you give your body that sugar rush, then it means that your body have to do something with it. What works is that you have to have enough insulin for the body to use the sugar for energy and for the body to take that sugar into the cells in order to produce energy. If you don't have enough insulin, then there's more sugar floating around in your bloodstream and it wreaks havoc on your body.
Dr. Clarke, what do we need to do to encourage more people, particularly in urban areas, to go in, to get screened, to be diagnosed if they in fact are dealing with diabetes, or be pre-diabetic?
Pre-diabetic.
Which pre means what?
Pre means you're predisposed, you're on the verge, you have sugar building up in your blood, but not enough to be considered a diabetic.
What do we need to do to, other than doing programming like this, what do we need to do to encourage more people to go in and get screened and potentially get treated?
I'm glad you asked that. Now, first and foremost, we're glad to come on this program so you can send the message out to people about diabetes. It's all about education, education, education. But you have to give education a way that's understood by people. You have to educate people in a way that they will understand. So we don't use fancy words and we don't use fancy presentations.
No medical jargon.
No medical jargon. That's why I talk about sugar.
No acronyms.
In my community,
Right.
it's sugar. So if you're feeling dizzy, go take some tea because you have a sugar problem. That's what they say.
So language matters.
Language matters. And so it's very important that we, especially the federally qualified health center, have educational activities outside of the health center to promote the need for wellness and prevention and get yourself tested.
In a minute left, we have education, awareness, treatment.
Lifestyle change.
How much of this, real quick, is family history and how much of it is lifestyle?
A lot of it is genetic. A lot of the people, especially Black people, were predisposed to diabetes. Especially in my family, everybody has diabetes and they're on insulin, except myself and a few people because we've changed our lifestyle.
So you think, you don't think, you know in your case and others that lifestyle competes
helps.
effectively against people's family history?
If you keep reducing the amount of sugar you put in your body, it does not stress the body to produce the insulin to work on the glucose, which is not there.
You've been listening to Dr. Pamela Clarke, President and CEO of the Newark Community Health Centers, a federally qualified healthcare center. Every time you're with us, Doctor, we learn something new. Thank you.
Thank you.
Stay right there. That is it for this particular edition of Think Tank. But make sure you catch Think Tank, the podcast, with conversations just like this. The only thing that's different is we have extra exclusive commentary and analysis only available on Think Tank, the podcast. You can find us on Apple Podcasts, Google Play, Spotify, and a variety of other media digital platforms. I'm Steve Adubato. That is it for this particular edition of Think Tank. Most importantly, though, make sure you think for yourself, especially about diabetes, next time. Thank you.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, RWJ Barnabas Health, NJM Insurance Group, the Fidelco Group, the Healthcare Foundation of New Jersey, Horizon Blue Cross Blue Shield of New Jersey, the Port Authority of New York and New Jersey, Summit City MD, and by PNC, Grow Up Great. Promotional support provided by New Jersey Monthly and by bestofnj.com. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.